Podolsky. I'm the Chief Executive Officer here at Cambridge Medical and Rehabilitation Center. Cambridge Medical and Rehabilitation Center is a long-term care and post-acute care facility designed to care for patients after their acute episode of illness in a short-term acute care hospital, whether that is locally, regionally, or abroad. And when their next level of care is indicated, we're here to help take care of patients, whether it's post-acute care or rehabilitation, or perhaps for chronic disease management in an inpatient setting. Cambridge Medical and Rehabilitation Center also provides outpatient rehabilitative services in addition to our inpatient services, which include physiotherapy, occupational therapy, speech therapy, speech-language therapy, and respiratory therapy. In addition, we also provide a very unique service that is actually one of a kind here in the United Arab Emirates, which is called the Transitional Vent Weaning Unit Program, where we take patients and accept them from ICUs locally, regionally, and abroad that are stable medically but require individualized, long-term, bespoke, or customized weaning protocols off mechanical ventilation. We have consultants in intensive care medicine that focus on working with patients to design weaning protocols off the ventilator, while at the same time our rehab experts in physiatry and in our therapies work with the patient to strengthen them both physically and neurologically to be able to manage their airway successfully off mechanical ventilation, which may take a period of 6 to 12 months. So that's a little bit of a summary about Cambridge. We're here in Abu Dhabi, as well as in Al-Ain. We're licensed for 90 beds in each facility, and we accept patients from neonates, 3 months of age, to our oldest patient, which was just over 100 years of age. So we have a wide range of types of patients that we accept from all over the Emirates, as well as throughout the GCC. My presentation is going to focus on the value proposition of long-term care and rehabilitation in terms of the continuum of care and the value proposition with regard to the overall expenditure of scarce resources within healthcare. Oftentimes, or in the past, these patients who were eligible for long-term care and or post-acute rehabilitation languished in short-term acute care hospitals at very high cost in an inefficient manner and not improving their overall quality of life or their outcomes. What we can do here at Cambridge is, in a highly efficient manner and in an effective manner, be able to provide targeted rehabilitation, chronic disease management, and do so in a much more cost-effective manner with a focus on integrating the patient back to home and into the community to have a productive and high-quality life moving forward. We don't warehouse patients. Our goal and our focus is to rehabilitate them to the point where they can return to work, return to home, return to the communities. I think that rehab centers are going to be very, very good and very close partners in this process. What needs to happen is to what I call expand the continuum of care. Right now, the continuum of care in the GCC and in the Emirates really is limited to short-term acute care hospitals and highly specialized polyclinics. But as we continue to care for an aging population with chronic disease, as well as a burgeoning younger population that may be prone to injuries, partnering with the insurance companies to provide a high-value proposition with a cost-effective approach to caring for patients with the specific goal of great outcomes will be crucial for not only responsible healthcare planning, but for the utilization of very scarce healthcare resources in terms of drug. As patients continue to flow out of short-term acute care hospitals or for being cared for acutely abroad, they're going to need highly specialized targeted approaches to their rehabilitation. At Cambridge Medical and Rehabilitation Center, we have a very targeted focus in key areas of musculoskeletal, neurorehabilitation, pediatric rehabilitation, and as I mentioned previously, respiratory rehabilitation related to patients who are on mechanical ventilation. So targeted approaches with absolute expertise in those areas clinically will only result in better outcomes for the patients and at a lower cost to the insurers going forward in terms of being able to bear the cost in a responsible manner. Oftentimes, patients who are not Abu Dhabi covered FICA patients ultimately may have access to that coverage either because of a residence that they have in the emirate or a job within the family that may tie them to the emirate of Abu Dhabi, allowing them to be able to access FICA coverage. If that's not possible, also many of these patients or family members have access to us through either the military, via military and HQ, as well as through various police agencies that also extend coverage as well. Finally, we are in the process of developing individualized relationships with private insurers, so that a number of private insurers are now coming on board, helping to cover the cost of rehabilitation or post-acute rehabilitation for these patients. So we're very much expanding access by broadening our horizons with regard to the various insurers and the various individuals that are, or agencies that are helping to pay for these patients. I think the Congress is an exceptional opportunity for an exchange of ideas in a market that's growing very, very quickly, that has an extraordinary amount of demand with regard to expertise and idea sharing throughout the industry. And I think it's a wonderful opportunity to really bring the best and the brightest together to be able to further address the very imminent issues of economic pressures on healthcare expenditure, yet for a population that's going to have increasing demand based upon age and growth of the population for healthcare. So this is a wonderful opportunity to idea share, to shamelessly share ideas, and to really develop coherent policies towards caring for patients in need of health.